this segment of ours, as we move on, I have the privilege of calling upon two very special guests. Our first speaker one day was reading the book Being Mortal, Medicine and What Matters in the End by Atul Gawande. This book opened her eyes to aging with dignity and dying with grace. She believes that the medical profession tries hard to cure. However, the needs of the old and the sick are beyond cure. The elderly deserve to not just be looked after, but to retain their independence and not get infantilized. And at the end of the day, all of us are going to reach there. This inspired her to create India's leading and fastest growing home healthcare company, which she co founded in July 2013. The company has 4,000 plus employees and operations across 40 plus cities in India and brings in home to patients the full range of geriatric, chronic post-operative care as well as light healthcare services. Our speaker wears many, many hats. He is the co-founder and chairperson of Portea Medical, a company that provides non-hospital healthcare services. She also holds a number of board positions at Pfizer, Procter & Gamble, Hygiene and Healthcare, Manipal Cigna Health Insurance, and the Indian Institute of Management, Calcutta. She is also a promoter for well-known startups such as Big Basket, a unicorn now, Bluestone, Home Lane, and Fresh Menu, among others. Among many awards and recognitions, she has been featured in the list of top 20 outstanding female business leaders by Forbes Asia 2021. She has been part of Fortune India's 50 most powerful women in business for consecutive 7 years, 2015 to 2021. With great privilege and with a lot of happiness, I would like to invite Ms. Meena Ganesh, co-founder and chairperson, Portea Medical. Now, joining Ms. Meena Ganesh, our second speaker was taught from childhood to not aspire to become a princess. She was taught that princesses are taken care of, but princesses don't take care of themselves. She was raised in an environment that ingrained in her the belief of working towards excellence and not towards money. The lessons given to her were on areas of making a positive impact on society and how to build excellence in what she does. She believes that if you are excellent and outstanding in what you do, money will follow. Having imbibed a strong value system, she created a reputed chain of pathology labs, which is today a household name in India. The current organization has a loyal customer base across India, South Asia, and Africa. She is a global thought leader in the healthcare industry and has played an instrumental role in changing the pathology industry landscape in the country, from being a doctor-led practice to a professional corporate group in an extremely unregulated, competitive, and fragmented market. He was an independent director for Marico Kaya in the past and is currently on the board for reputed Indian companies such as Torrent Pharma, Shoppers Stop, to name a few. She is also an advisor to Baylor College of Medicine, Texas, and is on the global advisory board of AXA, a Paris headquartered company with $700 billion under asset management. So let's put our hands together and invite on stage Ms. Ameera Shah, promoter and managing director, Metropolis Healthcare. Welcome, Ms. Meena Ganesh and Ms. Ameera Shah.
Thank you for that very kind introduction. And it's indeed my pleasure to be here with you and sharing the stage with Ameera, an entrepreneur, a business person who's obviously very, very acclaimed and also a good friend. We've met on multiple occasions and wondered how to improve the quality of healthcare in this country. And she's leading a lot of initiatives as part of one of the apex organizations of healthcare called Nat Health. So, Ameera, great to have you as my co-speaker here.
Absolutely, Meena. Such a pleasure to chat with you. It's not often, that you pair two women together in a fireside chat. To be paired with you in healthcare, it's amazing, and I think we'll probably both be able to bring some very different, unique perspectives to this conversation. So, really looking forward.
Yeah. So maybe I kick this off, Ameera, and let me ask you a question, and then we'll take it from there if that's okay. So what I've read and what I've seen is that you took over a family business which was dominated by the men, and then you have stepped up and completely taken charge transformed it, and also stepped up and taken huge amount of debt personally so that you could become a very significant majority shareholder. This was a huge transformation. I'm sure a significant risk that you took on your part. How did it all pan out? And when you look back, how do you feel about the decisions that you took? Could you throw some light on that for us?
Yeah, sure, Meena. Actually, it's often a misunderstood thought that it was a family business, and actually, the reality was slightly different. My father is a pathologist and was building his own practice for 20 years before I came back from the US to India. My mother, same thing in gynecology. And when I came back, I felt there was an opportunity to build an institutional brand in healthcare. And that's where I felt pathology would be one that's scalable and can actually build something pan India. And my father and I, sort of, very shoulder to shoulder, carried sort of that responsibility. Him on the medical side, me on the business side, and we went from we worked together for the first 3-4 years, and then he sort of moved into more of a retirement mode. But in the first 3-4 years, he brought the medical knowledge. We had one lab at the time, and of course, we've gone from having one lab to where we are today, about 170 labs and about 3,000 centers in a few countries. But to your specific question around taking risk, I genuinely believe as entrepreneurs, what differentiates successful entrepreneurs from maybe people who don't dare or have the courage to go into entrepreneurship, who don't always become successful, is that you're constantly operating in a world of uncertainty. Everything is uncertain. Your business model, your product, your service, how people will respond, what you can charge, everything is uncertain. And being comfortable in uncertainty is what enables you the ability to take risk. And actually, in India, we're all brought up actually to not take risk. We're all actually brought up to say take the safe way, and much more for women than for men, right?
Yes.
Stay away
Yes.
from the dark area. Something will happen to you. Don't take a taxi. This will happen to you. Don't wear shorts. This will happen to you, etc., etc. And I think we are so sort of told to take the safe way that it's very difficult then to learn how to take risk. And I think for me, I came to a point in 2015 where I said it's up to me. I was 35 years old, and I said, look, it's up to me. I'm in a situation I'm not happy. I can either cry about it and complain about it, and I can keep waiting for the situation to change for me, or I can do something and change it for myself. And I decided to take a humongous debt of 600 crores
Yeah.
when I didn't even have 6 crores in my bank account, to really take and buy majority in my company, because I believed that if I had majority and I had the ability to navigate the destiny on my own for the future without the other sort of people and other baggage of the past, then I felt like I had the confidence that I could do a lot with it. And it was really what I was doing was punting on my own confidence in myself. And there were moments of a lot of doubt, periods of waking up at 3 in the morning, sweating and having pangs of what have I done, you know. But today, when I look back, I'm very proud of myself. Not only because Metropolis has gone on to go from strength to strength. We were valued at 2,000 crores in 2015. Today, we are valued at about 13,000 crores. But not for that, but because I was at a mode where I could choose to be timid, shy, and not believe in myself, or I could choose to believe in myself, and I chose to do that. And I've come out feeling more confident today.
It's fantastic. Very, very inspiring story, Ameera, about how you took the bull by the horns, took the courage to actually break through, and obviously we all know where you've reached. It's an amazing success story, and more success to you in the years to come as well.
Thank you.
The second question that I wanted to ask, and then I'll hand it back to you, Ameera,
Yeah.
for whatever you want to ask me, is I have read that you have said an organization or a startup or whatever we are talking about here is a reflection of the set of the values and capabilities that the promoter entrepreneur brings to the table or the leader brings to the table. How do you ensure that uh, the positive parts of what you bring to the table are the ones that are imbibed, and not necessarily, because all of us have things which we could do without or we could improve upon? How do you make sure that the positive aspects of the promoters or the founders capabilities and value systems are the ones that are taking prominence in the organization?
I think, Meena, it's a lot like parenting, right? And I think, I think all of us who have children or who aim to have children at some point will face this struggle and this conscious thing about saying, how do I improve myself? Because I can want my child to be adventurous and a risk taker and all of these things, or amazing and a great learner and disciplined. But if I'm not, then really I can't role model that to my child. And it's the same thing with an organization. If I say I want my organization to be really, ambitious and fast moving and decisive, but I'm not, then really that's not going to happen. So I think a lot of it is just us working on ourselves to role model what we hope that other people will absorb, and then stop trying to shove it down their throats, but allow them the space to absorb, and by watching us in what
Yes.
we do, and that leading from the front. And it's not only leading from the front, but constant introspection to say, hey, what are my weaknesses? What is it that I need to fix? What is it that I need to do better? And working on those things actively. So I would say that's definitely one. But I think also, as you move from a startup in a small company to a more mid-sized organization, it's recognizing that how much ever we work on ourselves, we don't have all the positive qualities, and we will continue to have some negatives. And therefore, it's essential that the organization, which is a being on its own, like a child, has the influences of the mama and the kaka and the chachi and the masi, the same way has influences of other professionals in the organization, where the organization can imbibe their positive qualities as well. And I think that's what would lead to a really healthy, well balanced organization. And being able to, as the promoter, take that step back and allow for other influences, especially when you know those influences will come, good and bad, again, I think is essential. It's difficult to do, but I think it's essential to do.
I really like the family examples, or the relevance of how you use different relationships that are there in the ambit to create the right kind of influences on the organization. I like that very much. Over to you, Ameera, now. Thank you.
So, Meena, you've had such an amazing journey from being, this constantly written about investor and all these different, startups, some of them which have become unicorns, and done so much. And then you decided to take Portea and actually run it, and actually get your hands dirty, get your, elbows deep, and actually become part of not only the investment thesis, but actually part of the operating environment. And I know the book was obviously a big inspiration, but what have been the things that you've had to change and do differently to move from sort of the more investor mindset to the more operator mindset? And what have been some of the learnings that you brought from the investor mindset, and what have you let go of?
So, Ameera, actually, I might want to slightly correct the
Sure.
narrative here, that I've always been an operator.
I see.
From I've always run companies. My first startup was in the year 2000, which I ran, called Customer Asset, which was in the BPO space. After that, it was Tutor Vista, which was in the education space. And then in the year 2011 is when we started to promote multiple companies. So from 2011, there were two journeys that were happening in parallel. One was identifying opportunities, building businesses in those opportunities with the help of others who are perhaps co-founders, but are also doing the actual management and operations of the business. When I exited from Tutor Vista in the year 2013, we had already by then promoted Big Basket and Bluestone, and at that point in time, I was looking at what's the next big opportunity in this country, what requires disruption, and I felt that healthcare was an area that required significant disruption. Even though there's a lot of investments going on in the facility-based spaces, the outside of hospital care was something which was really lacking in the country, with hardly any investments going on. So I spent a lot of time, and that's when the book that you refer to, all of that played on my mind, and my own personal experiences with what I went through, taking care of my parents and their health, and knowing the lack of a lot of resources outside of hospitals and facilities. All of that coalesced into a thesis that this is something which needs to change in this country. And that was the genesis of Portea Medical in 2013. And then, of course, over the last 9 years, it's been an incredible journey of uh, twists and turns and learning, being an outsider in the healthcare industry, coming in, trying to understand how I can add value, where I can disrupt, making sure that the rest of the healthcare industry starts to see this as something which is complementing rather than competing, rather than creating a different channels of businesses which was bothering them. How do you make everybody understand that this industry actually needs all these pieces? It needs clinic based, facility based, it needs large diagnostic chains, it needs healthcare and at home and digital healthcare. All of these pieces have to come together for things to really pan out in this country. And as it happened, sometimes you just think back and feel that all of this setup I was doing so that when the pandemic comes, we can actually make a difference in this country. So in 2020, when the pandemic hit, suddenly there was no other way but to care for a lot of people, both COVID and non-COVID people, patients at home, because it was not possible to care for them in such large numbers in facilities. The facilities were overrun by COVID, so there was no place for non-COVID. There were too many people to be put into the facility, so even if they had COVID, so they had to be cared for at home. So I think that was sort of a coming of age for the industry of home healthcare, and one hopes that this will become sort of a growth, a huge growth hockey stick for this whole industry. So that's been my journey. But just to answer the other part of your question, the two hats that I wear, that of an investor and that of an operator. Uh, the operations or running a business, thinking about what's new to be done, building the team, making sure things work, make understanding where things are going wrong, taking help from allies, and using all of that to improve. That's what comes more naturally to me as an investor. It's really from the year 2010, 2011 that I have played that role as well. So today, if you ask me, I think I'm sort of more quite comfortable wearing both the hats, but it's been a journey of
No, and
different.
I'm sure as a investor, there have been a lot of learnings that you've now applied as an operator and vice versa, right? Because you get a ringside view from the other side. That
Exactly.
can be useful. I mean, as promoters, often, we are told we are blinded by, as operators, we are blinded by our own horse blinders, and investors tend to look at things sometimes more objectively. So,
Correct. Yeah.
bringing that has value. But
Definitely.
if we talk sort of more about leadership and sort of, in your opinion, wearing all these different hats, what you think really differentiates, what personality traits, two, three of them that really differentiate people who go on to land up doing something significant in their professional life, versus somebody who may put a lot of effort but may or may not land up making the same impact. What do you think are those two, three personality traits in your opinion?
So, one which you mentioned earlier, which is the courage to take really tough calls at the time when you need to take them, and to take those risks, and say that yes, I'm going to put it all out there. And we have done that multiple times when in the various startups that we've done, both of us going all in with nothing else to back up. The first startup that I did, customer asset, both Ganesh and I were co-founders, and left, both of us left nice cushy jobs in MNCs and became co-founders with nothing else but our brains and the hope that this is going to work out. So you're putting a lot on line, and many of these startups you find that will go through ups and downs, and there will be things which don't go your way at all. There's a lot of failure, there's a lot of stress. How do you keep your courage and your resilience to that? So that, to me, is top of the line always. The second, especially if you're in early or mid career, when you're working in a corporate, I would always advise people to not look at your job description or what has been written out to you as a box. Rather, it's a platform from which you grow, from which you deliver as much more than what is even asked of you. Always do more than what is asked of you. Always ask less than what is given to you. Then you will always be supremely valuable. And in the long run, you will be much more successful and will reap the benefits of whatever you put in. It might sound a little, uh, I would say, a little philosophical that you ask less and wait for more. But here I'm not talking about don't toot your horn. What I'm saying is you be more valuable for the company than they think of you. They should, what they are giving to you should seem small to them, because the value that you generate is so huge for them, because you step out of your box and you do much more for them. So that's the second thing. And the third for me has always been to have a learning mindset. The world is changing so rapidly. Technology, especially a space that's something of great interest to me, and even in the healthcare space, there's so much of transformation going on that if you're not looking at learning all the time and learning from the younger generation, learning from people next to you, learning from the field, and being letting go of your ego and say, I don't know probably anything. I may know something, but I really don't know everything. That is for sure. Probably I don't know anything. So, how do you start from that place and then keep going and learning more and more?
I fully agree with you, and if I can add on there, I mean, I also find that there are some people who will come with the problem, often most, and then some who will say, "Hey, this is the problem, and this is my proposed solution." And I find that mindset of always looking for the answer of how to solve a problem as again a big differentiator in link to what you said about learning mindset, right? That curiosity to keep searching and saying, I found the answer, or I found two, three possibilities on how to solve this. I've often seen that as a big differentiator as well.
Absolutely.
Yeah. Back to you.
So, Ameera, where do you see Metropolis going, and what kind of a disruption that you want to bring about in the whole diagnostic space? I think the story is just half written. There's lots more to go. There's a lot more of new technology coming, whether it is bedside or at the patient and self monitoring and so on. So, where do you see this happen? What's going to change in the diagnostic industry?
So I think lots of ways forward, right? I mean, I think we're really seeing some structural changes in the industry I haven't seen in the last 20 years. And actually, unlike the expectation that it will be driven through management, government regulation, or change of channel of payer like insurance driven versus out of pocket, what's happened is that it's changing more so because of market dynamics and less because of government intervention. So that's been very interesting and I think unexpected really by the industry, right? I think two, three things will happen, right? I think diagnostics will and should become far more accessible. Today, there's a statistic that says that only 6% of India has ever been diagnosed. And that is a scary statistic. Obviously, that's majority in the metros and the smaller towns. But the fact that there are so many people in smaller towns and villages who just don't even get diagnosed because either there are doctors who don't have the required knowledge to do the right diagnosis, either because the facilities are too far, either because it's not affordable, or they don't do the test locally. There are many reasons why India remains poorly diagnosed. So I think from that perspective, the opportunity remains large. But really, the complexity comes in healthcare about how, number one, we have such different segments of the population, and affordability and quality remain so vastly different. And I think companies have to find ways to actually have multiple models to serve different segments of the customer. I think the biggest blockage that I see in healthcare that I think will have to change is organizations have a DNA, and that DNA then actually restricts them from really going into new segments and having different business models and new ways of operating. For example, we pride ourselves on really being very, very quality conscious, and we want to use the best equipments, best reagents, best ways, best people, all of that. And the conflict that I always get stuck in is I know that there's somebody in a small town or small village who wants diagnosis and needs it, but to make it cheaper, I have to somewhere use a different parameter and barometer of quality to serve them. How do I morally and ethically give
Yeah.
a lesser quality to somebody in a different smaller town? But if I think about it differently, it's still 100% better than what they're getting today, but it's lesser than probably what I'm giving in a metro. So I think these conflicts are the ones I think we need to see differently and adapt different business models in organizations. So I think that's going to be a big change in the way we need to approach the market. But I think it's going to be really exciting because I think the digital, right now, these worlds are separate. The digital first world, the brick and mortar world, they're sort of competing, they're sort of not. But I think the true value for a customer and a consumer and a doctor will really come when these worlds integrate, when people start to offer these services in an omni way, very, very seamlessly to customers. Because frankly, patients in India suffer and struggle in healthcare. It's not a seamless system. It's difficult for them, and I think it's our job to make it easy.
Very well said, Ameera. And I really look forward to watching you bring about this transformation in the sector.
Yeah.
Back to you then.
Yeah. So, I think what's been really interesting about the home services space, Meena, is how it's really flourished. I know you've been doing this for a long time, but I'm sure in the last 2, 3 years, you've seen an unprecedented jump scale of the kind of work that you're doing. And when COVID came, your capacity must definitely not have been ready to deal with that kind of surge. So, what were the things that you did to sort of really scale up quickly? How did you manage your own mindset with the kind of pressure that I know we all faced in healthcare, with our own team sick, with our own people down, at the same time customers coming from every angle needing services, in some cases abusing the hell out of us, maintaining quality. How did you deal with all of this, and how did you keep your mind calm?
Yeah, no. So on the mind calm, I'll tell you that I still have PTSD from the wave two. I still get up in the middle of the night and say, "Oh my God!" Is that? But yeah. So jokes apart, it was the problem was at multiple levels. One is like you rightly said, and more so in the wave two, that there was paucity of our own and the medical staff on the field. There was a paucity of people in the center and the administrative teams because they were all falling sick. And third was a paucity of medical equipment because everybody wanted an oxygen concentrator and what they called as a ventilator at home. So, what do you do suddenly to ramp up on all of these? It was a real problem. But I think a few things worked very well for us. One was that because wave one pushed us and we sort of stepped out in wave one to say, okay, how do we create a completely remote management entity that every piece of what we do can be managed with technology, with the help of people working from their homes or wherever, so that the capacity at the central capacity, the administrative capacity can suddenly be multiplied very quickly, even with people working part time, sick people willing to take 1 hour, 2 hours. That's okay. We just pull in your capabilities and your capacity of whatever you have, so that we are able to maximize that. So going through that initial transformation, quick digital transformation of how we operate, really helped us to scale up our internal systems and our internal capacity. But the problem of capacity of people on the ground was really fierce, and there's no answer to that. While, of course, we did a lot of quickly hiring, training them, giving them very clear, well defined SOPs, using technology to make sure that the training, their SOPs, and the monitoring of what they do is much more tighter, because you can't always do it in at leisure as you would have done in the other times. But still, it was a huge problem. I don't think we were able to do justice to every request that came. It was impossible, especially in the month of May and June the previous year. It was crazy. And then, of course, the third piece was the importing of. I mean, there was not enough oxygen concentrators in the country. Never mind oxygen concentrators with us. So, how do you quickly put in methods to import, to get them over, make them available, train people on the ground so that you can roll out all the medical equipment? It was a real learning for us, and in a matter of about 3 weeks, we were able to pull together about 8,000 OCs into the field and manage them and put technology to run the whole piece. So it was a lot of big learning for us for sure.
But those are big numbers and incredible, to get those done as quickly as you guys did. But I remember this time when I was in Dubai at the time, and I remember my husband and me, and we were hearing about what was happening in Delhi specifically, where there were 30
Yes.
minutes, 1 hour left for patients to have oxygen. And we went and said, let's collect all the OCs we can in Delhi, I mean Dubai, and we found
Right.
all of 27 in all of Dubai. We bought them at any and every price. And I remember calling few friends, including you, and saying, "Do you
Yeah.
need them?" And she's like, "Yeah, I need them. Send me 40 right now." And I was like, which I need amongst many, many people. So I know, I mean, that time was scary, and I'm glad it's behind us. But it's been so good to chat. I think we should open it up for Q&A. What do you
Yeah.
think?
Yeah, absolutely.
So I think we see a bunch of questions in the chat. And should we take those, or I don't know whether we're going to have live? Anjali, you want to come
Anjali
in?
is
Yes,
going to take
yes.
it.
Thank
Yeah.
you. Thank you so much. Thank you so much, Miss Meena Ganesh and Ameera Shah, for that insightful conversation and giving us an opportunity to know you a little more closer. While we definitely read a lot about you in the news and on Google, but having you right in front of us and getting to know you has been a phenomenal experience. So we definitely have some questions coming in, and we shall start with our segment sponsors. I would like to call upon Shreya from FlexiBees to ask her question, please. And Shreya, please come on camera.
Hi. Hi, thanks, Anjali. Hi, Meena. Hi, Ameera. I'm Shreya Prakash. I'm the CEO and co-founder of FlexiBees. It's been amazing listening to you guys talk. Such a candid conversation and this ringside view of how such brilliant and impactful businesses are built. Thank you for this, and thank you, IIMBueX. My question is for Meena. Meena, the pandemic has unleashed the power of flexibility for both businesses and people, especially women. So I was curious to know, do you think there is a role that flexibility at the workplace has for women working in healthcare? And if so, what is that role and impact it can create?
Shreya, it's a very good question, but healthcare requires to be on the patient side, which
Yes,
cannot be flexible and which cannot be remote, unfortunately. But that said, there are quite a few roles at the back end, which are administrative, sales, marketing, management, technology. Those are the roles. Certainly, that it's definitely possible to have a hybrid work culture. But most of what we do is that on the patient end. And what do you do? Out of the 4,500 people that I have,
yeah,
probably 500 are not on patient side.
right.
So they have to be there, and they were there right through from wave one to wave two to wave three to whatever nth wave. We have to be on the patient side only. There's no
Yes,
other choice.
absolutely. Absolutely. And kudos to both of you. I've been using Metropolis, of course, throughout the pandemic. Kudos to both of you for having tackled all the demands of the pandemic the way you guys did. Thank you so much.
Thank you.
Absolutely, it's been wonderful. Let me share. I have an 89-year-old mother-in-law, a grandmother-in-law, and then having Metropolis and Portea makes our lives so much easier and gives us that sense of belief that, yeah, we would not just be left without proper medical services and care. So thank you so much for that. We have our next question coming in from our segment sponsor, Focus You. May I call upon Arun or Tarika for the question, please?
Hi, wonderful being in this conversation, guys. Very enlightening indeed. My question is for Ameera, actually. So, as we scale a services business, there's always this question of having to invest disproportionately on people, technology, resources, well before you actually see the, results, or well before it's actually justified. Uh, it may be seen as blind optimism, or it may be seen as a calculated risk. My question is to Ameera that since you've been in a similar journey and you've really scaled your business, phenomenally, what are the watchouts that you would say for founders who are in this journey and who are going through this investment? Really?
Thanks for the question, Arun. I think it also depends on what you're doing and which stage, etc. For example, when I started building Metropolis, we are in the acute illness business, right? Healthcare earlier used to be 95% illness and only 5% wellness, which meant you're dealing with people who are undergoing significant illnesses at this point, and that tends to be very conjoined with what the doctor recommendation is. So actually, in our business, there was never felt to need much of a need to invest in technology or any of those things. Actually, what we did was we invested in relationships, and it's only during COVID that you realize that, oh God, this scaling without automation and technology and managing is going to be just too hard. So that started a new journey of actually really investing in tech for some of us, and digital transformations along the way. But honestly, till 2019, technology was not a significant a tool in traditional healthcare. Going forward, of course, that will be very different. But I think if I look back and I'm very candid about the mistakes that I made or the learnings and what I would do differently, is two, three things. One, my investment in my management team till 2018 or 19, I would say, was always behind what I needed. Part of that was because as a small company, we were not able to attract the best of talent. And part of it was always as a private company, which was not with the mindset of, incur losses for a certain period and then make profit. You always had this need to make profit at every moment of time. There was always this constraint of resources of not over investing into people. And I wish I could have done that differently, because I think we would have been at a very different place at this point of time. The second, going back to my original point, I wish we had invested far more in technology and automation at a much earlier stage than we landed up doing. So I would say for most founders, we keep getting stuck in these tricky situations of making tough choices. And luckily today, there is a world where it is acceptable to overinvest early and make losses for a period till you can make money. Of course, that means a significant dilution of equity. And I think you got to keep balancing on how you retain enough influence, enough equity, enough decision making, even if your equity is low, to make sure that you're able to see through the end of this destiny. But at the same time, have enough capital and resources to overinvest. But remember that overinvestment also comes at its own cost. What that means is that when you have too much capital, your decisions sometimes may not become as thought through because resources are available. And therefore, you got to really be careful to make sure that even if you have a lot of cash in your bank, you think 100 times before you spend, to make sure that you're disciplined in your unit economics, disciplined for your future path to profitability.
Right. Thanks a lot, Ameera. This is insightful.
Thank you so much. I see we have a lot of questions in the chat and we shall try and take them up separately. But I have one very interesting question coming from Sharad Tibdewal, and this is for you, Ameera. Debt is way cheaper than equity. The question is, it is the less taken path in the current scenario. Why did you go ahead and choose this path?
Well, at the time, I was trying to buy out, a private equity fund which was in the company, so that I could get majority stake in the company and therefore be able to influence the decisions and really be able to influence the management in a better way. If I took equity, then of course that wouldn't happen because I still wouldn't own it. So the only solution I had at that point was to take debt. And I'll tell you, in 2015, it was very, very unusual and almost never happened that a promoter took debt at ridiculous percentages of interest. And I took debt, by the way, at the time at you're gonna look at me like I'm crazy, at 20% interest
Wow.
in 2015, to buy this equity. And what that means is that I had to be confident that the value of the company was going to grow faster than 20% a year for me to be able to pay it, and then figure out how to actually pay the interest every year, even though I paid the full capital at the end of the period, which meant I did the most tax inefficient things, which was to declare dividends from the company, pay tax on it, take money into my company, pay tax again, and then pay interest. So there were tough choices, but I was clear that I was going to take that punt. I was going to pay exorbitant interest. I was going to pay double taxation on that money, because at the end of the day, that was my best option for what my long term future meant for me. And it was worth taking that risk. Look, if it hadn't worked, I would have lost everything. I would have not only lost my company, I would have lost whatever family wealth there was, and many, many other things. I would have lost the trust of my employees and customers. But that was a risk I had to take at the time. And thankfully, all of us as a team together were able to pull it off.
Thank you so much. I would agree that definitely for you at that point of time must have been a massive, massive risk. On behalf of the entire IIMB alumni, I go ahead and thank both of you, Ms. Meena Ganesh and Ms. Ameera Shah, for spending your time and sharing your wisdom with us. It's been a wonderful conversation, and thank you so much.
Thank you for having us. Bye-bye.
Bye, Meena.